Good afternoon, everyone. I think you're all coming into the meeting. So we're going to go ahead and get started. On behalf of the University of California, thank you for tuning in today for the July 2024 edition of the UC Alumni Career Network. My name is Caitlin Green. I use she, her pronouns, and I'm the Director of Career Services at the UC Berkeley School of Public Health. Over the last decade, I've had the privilege of supporting UC Berkeley undergraduates, graduate students, and alumni in clarifying and pursuing their career goals, including as a career counselor and pre-health advisor. In my work at Berkeley Public Health, our diverse graduate student population includes not only early career professionals earning a master's degree who want to go on to medical school, but also physicians who've returned to school, often while working, to earn their M.P.H with us. And so I'm honored to be moderating today's event focused on career pathways to the diverse and impactful world of healthcare and public health. This program is part of a UC-wide effort to unite and support alumni across our 10 campuses. We aim to equip you with the information, insights, and connections necessary to launch, grow, or expand your career. Throughout today's session, you'll have an opportunity to ask questions of our speakers by clicking the Q&A box at the bottom of your screen. We'll try and answer as many questions as possible during the event. I am pleased to be joined by three inspiring UC alumni. Tuning in locally today is Dr. Monica Hahn, a UC Berkeley and UCSF alumna who serves as Associate Clinical Professor in the Department of Family and Community Medicine and the Department of OBGYN at UCSF as a clinical educator for medical students and residents. As Medical Director of Hive Clinic at SF General Hospital, she practices perinatal HIV primary care in San Francisco's Safety Net Health System and engages public health capacity building for HIV services in the Pacific region. Also from the San Francisco Bay Area today is Baljeet Sangha, a UC Berkeley alumnus who serves as the Chief Operating Officer and Chief Strategy Officer at the San Francisco Health Network, the city and county of San Francisco's only fully integrated and public safety net health system within the San Francisco Department of Public Health. Joining us from the Berkeley campus is UC Berkeley and UCSF alumnus Dr. Michael Liu, our Dean at Berkeley Public Health. I'd like to invite everyone to join me in congratulating Dean Liu, who this summer has been reappointed as Dean of Berkeley Public Health for a second 5-year term. Thank you so much to all of our panelists for being part of today's event. So let's dive into our first question. We'd like to learn more about each of our panelists' personal and career journeys. So I'm going to invite each panelist to share their name, pronouns, what type of work they do now, and some key milestones in their journey to this point. And I'd like to start with Dr. Hahn.
Sure. Thank you so much. It's such an honor to be here. Thank you so much for that introduction and invitation. So hi, everybody. I'm Monica Hahn. I use she, her pronouns. I'm born and raised in the Bay Area. I'm the daughter of Korean immigrants and the first in my family actually to attend medical school and to go into public health. I live in Oakland with my husband, who I met in undergrad at Berkeley, actually, and we have 2 kiddos. Yeah, I'm a very proud graduate of multiple UCs, completed my undergrad degree at UC Berkeley, where I majored in molecular and cell biology, as well as a minor in ethnic studies. And then I completed my M.P.H at Berkeley School of Public Health before going on to obtain my M.D. at UCSF, along with a master's in science through the UC Berkeley UCSF joint medical program. And after medical school, I decided again to stay close to home as well for residency, since my family is all here in the Bay. So I actually went to residency in family and community medicine at UCSF. And then I stayed on to become faculty there. So now I'm currently an associate clinical professor in family and community medicine. I have a multitude of different roles, ranging from very clinical roles as a practicing physician, mostly in HIV care, and also roles in medical education and in public health capacity building, especially around HIV care. And just some key milestones that I was thinking of. I was really heavily influenced by my dear advisor and mentor, Dr. Ron Takaki, when I was an undergrad, who's really known as a remarkable ethnic studies and Asian American studies scholar and activist who I was lucky enough to have had as a thesis advisor and mentor. And he really introduced me to the work of Paulo Freire in critical consciousness and critical pedagogy, and really was someone who I think supported me in making the connections between the lessons we can take from like past social justice liberation movements and how to apply the critiques of our social structures and institutionalized forms of oppression like structural racism, in order to really better understand the root causes of the health inequities that we're seeing and still see today. And at that time in college, I had a really also deeply impactful experience working as a community health advocate and sex educator and counselor at Asian Health Services Youth Program, which is an amazing community health organization in downtown Oakland. And it was really there that I learned also about like the rich history of the community health center movement, tied to the racial justice movements of the 1960s, and just all the coalitions of communities fighting for economic and racial justice together, and organizing to improve the health of their communities, and really learning that history and the connections between social change movements and health and medicine. That really like crystallized for me the idea that you can be a physician and public health advocate and also an agent of change simultaneously, and that there's a place for advocating for healthcare and public health as a human right in the broader struggle for social justice. So that really led me to my interest in also chronic diseases where stigma plays a big role, such as in sexual health and HIV. And especially, I was drawn to HIV medicine as a field because of its strong roots and origins in social justice activism. So in residency, I really trained at SF General Hospital, where it's really ground zero for the early days of the HIV epidemic. And I really sought out extra training in HIV medicine because I wanted to become an HIV primary care provider. So I did an area of concentration in HIV there, and I'm proud to be now a co-director of that supplemental kind of education track for family medicine residents who want to become HIV doctors. So briefly, just currently what I do now is as a practicing family physician, my current main area of clinical practice is family-centered HIV primary care and perinatal HIV care. So really that means I take care of people living with HIV and their families in and around pregnancy. And I also train and supervise our HIV primary care track residents in our family-based HIV clinic in our FQHC training clinic. And at Hive Clinic, our perinatal HIV clinic at SF General Hospital. And then I'm also involved in numerous other related anti-racism and health equity initiatives in medical education, including being part of the UCSF anti-oppression curricular initiative, where we're really striving to overhaul the medical school curriculum to truly embody an anti-oppression and anti-racism framework. And I'm also clinical director and principal investigator for Pacific AIDS Education Training Center, which is a regional HIV capacity building organization that's housed at UCSF, where I'm involved in delivering trainings and support to HIV care organizations throughout the Pacific region. So yeah, that's a bit of an overview for me. Thank you.
Thank you, Dr. Han. I'll invite Baljeet to go next.
Absolutely. Thank you again for having me. My name is Baljeet Sangha. My pronouns are he, him. I will share that my career path stories are always very fascinating because that's not how life pans out, but we only have 2 minutes, so I will work through it. It is, life and career path stories are like movies. We watch a Chris movie when we get into the theaters, but what you don't see is all the bloopers, all the stuff that's on the cutting room floor, the jobs you didn't get, the awkward conversations you wish you could forget and not live through. But so I'll spare you those, and I think we'll have some time and other questions to actually, I was trying to spotlight on some of that. But I would say some things I would love to highlight is, I was the first generation born in New Orleans, Louisiana, and came to California when I was about 9 years old and been in the Bay Area ever since. I think one of the things that I've learned, words I learned now through training and the M.P.H program, working through all the great programs I was able to take part in the University of California, I realized what I grew up in: food insecurity, not being able to have enough food when we were growing up, housing insecurity, having to fumigate every few months for cockroaches and stuff when you're living in New Orleans. And so all that stuff came to kind of to have an impact and influence on my life in a way that I didn't know then, but I certainly can appreciate now. And so with that, I think I would say some of the more formative elements or items that I like to share with you all in terms of my milestones of a journey here, where that I did attend an informational session, much like this one, prior to choosing the University of California, Berkeley School of Public Health. And it was an information session with the deans and associate deans at the time, where it talked about the wildfires and how a lot of mansions and other homes had burned down. And the program had shared, we're not here to rebuild those mansions. We're here to advocate for the individuals who aren't in the news and those individuals that can't speak up for themselves and provide solutions to the work that's being done there. And so that, I think, was a major imprint on my life and career. I think thereafter, I would say I was able to attend school, and I got a great internship, had an informational interview, and got an internship at the same San Francisco General Hospital, now Zuckerberg San Francisco General Hospital, the city and county of San Francisco's only safety net health system, and was able to just learn a bunch. Turns out I was doing an internship project to create a policy and procedure manual for an individual who was retiring. That person retired, and surprise, surprise, turns out the only person who knew what was going on was the person who had wrote the manual that they put together. So I became overnight, just 6 months out of grad school, and became the director of the supply chain for the only level 1 trauma center in San Francisco, which was terrifying. And people are coming in with all sorts of traumas, gunshot wounds, stab wounds, and they're like, we don't have this supply. And you're like, oh my gosh, I just graduated 6 months ago. I mean, I said that to myself, not to everyone else. But that, I think, was a big formative element. And I think one of the other elements that we will talk about is, there were a couple of jobs I applied for that I did not get. And I think that really helped frame kind of the elements I knew I could contribute to our field and to the communities we serve. And I look forward to sharing more about that. But again, thank you for letting me be here with you all this afternoon.
Thank you so much, Baljeet. And Dean Liu, your turn.
Thank you, Kaylin. And hi, everyone. My name is Michael Liu, he, him pronouns, and I'm the Dean of the School of Public Health at UC Berkeley. Well, let me first just thank the UC Alumni Career Network, for organizing this panel. I love the UCs. I've actually spent almost half of my life at a UC, 5 years in the joint medical program, where I got my MS and M.P.H from Berkeley, and my MD from UCSF. Then I spent 4 years at UC Irvine doing my residency in the OBGYN, and then 12 years at UCLA as a professor of OBGYN and public health. Then I took a break from UCs and went to work for the federal government as the director of the Federal Maternal Child Bureau before coming back 5 years ago to become dean here at UC Berkeley. So as you can see, I love the UCs. I still believe that it's truly one of the most powerful engines for social mobility, for social transformation in the world. And I'm just so grateful to have this opportunity to talk to all of the alums from across all the UCs. The second thing I'll say is that since I'm a dean, I'm going to do a shameless plug for the school. And today you're going to hear from 3 people who've had some pretty awesome jobs in our careers and still fighting a good fight to help make the world a better place. We've all had very different career paths. And I think that's the purpose of this panel, is to show you the different career options, whether you have an MD, an M.P.H, or both. But the one thing that we have in common is that we got our M.P.H from the best school of public health in the world at UC Berkeley. So if you're thinking about getting an M.P.H, I just ask you to give us a good look. In terms of career highlights, as a medical student, I started the Suki's Clinic, which in the last 30 years have served probably more than 10,000 unhoused and indigent people in the Bay Area. But equally important, probably changed the hearts and minds of a lot of doctors and nurses and health professionals. And that's something that I'm truly proud of. As a professor at UCLA, I educated over 1,000 doctors and public health professionals, and attended more than 1,000 births, and really focused my research on racial ethnic disparities in birth outcomes. And then, as the director of the Federal Maternal Child Bureau, I did some pretty interesting work that I felt like made a difference. I was led the creation of Women's Pregnancy Services Task Force, which established which women's pregnancy services will be covered under the Affordable Care Act without cost sharing. And so that includes contraception and mammography. I also led the launch of the Federal Maternal Infant and Early Childhood Home Visiting Program that provides more than 1 million home visits a year to some of the most vulnerable families and children in our nation. And I also helped led the development of the maternal safety bundles, which is now spread across more than 2,000 hospitals in the nation in an effort to improve the quality and safety of maternity care in the United States, and really finally contributing to doing something about the disgraceful maternal mortality problem in our nation. So that's what I been able to do in my career. It's been a pretty awesome career, and a lot of it has to do with the combination of the MD and M.P.H.
Thank you, Michael. And if I can, I'd love to stay with you for our next question, which is, what gets you up in the morning and what keeps you up at night? If there were such a thing as a typical week in your role, maybe you might consider sharing what that looks like, but really inviting you to share with attendees about the challenges and rewards in your role or your field.
Well, I'll tell you what keeps me awake at night. It's all these big problems that the world is facing today, from climate change to another pandemic, from all the chronic diseases that our healthcare system isn't set up to deal with, to social inequality. Right? And all of these are problems that require public health to be front and center in driving solutions. And what keeps me awake at night is, as dean, whether I'm doing enough to help solve these problems. And there's an urgency to these problems, right? That our house is on fire, and most of us are just sitting on the sideline watching the house get burned down. And we're running out of time. We got about 10 years before the house gets burned down. So what we do in the next 10 years are going to change the future for our children and their grandchildren for the next 100 years. And so I guess that's also what gets me up in the morning, because while most people just get to sit on the sideline and watch the house burn, I actually get to go to work every morning to work with some of the most brilliant scientists that are trying to come up with innovative solutions to solve some of these big problems, and to educate some of the best and the brightest students in the world, right? 1,200 public health students that we're educating at Berkeley Public Health every year, who are going to go out there and help bring about real change, and whether that's organizational change, systems change, and that's both in public health and community systems, healthcare systems, or societal global change. right? And so that's what gets me real excited about my job. If I could also maybe just take another minute to talk about my previous role at the federal government. And folks ask me a lot about leaving academia to going to public service, special federal service, and what that was like and why I did it. And as I mentioned, I worked 12 years as an OBGYN at UCLA, attended more than 1,000 births, really tried to gave my best and gave my all to take care of each and every single one of my patients. And yet, in the back of my head, I always knew that my impact was very limited, and that despite my best effort, and despite us kind of being the richest nation in the world, we consistently rank near the bottom on those standard metrics in terms of maternal child health. I mean, we have to do better than that. So when the opportunity came up in 2012, I joined the Obama administration. I was able to lead a federal bureau with an annual budget of $1.2 billion and a portfolio of 100 federal programs like home visiting and Healthy Start and Title V, maternal child health block grants, services for children with special health care needs, and really serve 60 million children and families in our nation, right? So that's kind of why I made that pivot, because in medicine you get to change lives one at a time, but in public health you get to change lives 1 million at a time.
Thank you, Michael. And Baljeet, I'll invite you to answer the same question.
Yeah, absolutely. It's I would say, as you mentioned in the introduction, I'm Chief Operating Officer, Chief Strategy Officer for the San Francisco Health Network, and I would say that one of the challenges of that, well, I say what gets you up in the morning is the ability to, in that role, have been able to do a lot of really cool stuff. Was the executive sponsor for rolling out the vaccine in 2021 to all the city, county of San Francisco, which included working with the Kaisers, the UCSFs, the Sutter Health, the Dignity Health, and ended up, if we were a country, San Francisco would be the most vaccinated country in the world by the fall of 2021. And we were able to give 70% of all race and ethnicities at least one vaccine dose, right? That's above the state average of 57% and 37%. That's the stuff that, wow, got me up in the morning. The ability to now, more recently, the country's largest publicly funded skilled nursing facilities in San Francisco, and was decertified a few years ago. And I was been one of the co-leads to kind of turn that around. And a few weeks ago, we got recertified with the Center for Medicare and Medicaid Services. So I think that's really some of the things that these really prickly problems I've never had before, and being able to be part of the team. Like, how lucky are we and how lucky am I and privileged to be able to be part of a team to solve these problems? I mean, it's something that I would be so grateful for and remember for years to come. But then the inverse of that is what actually keeps me up at night. And what keeps me up at night is, really just the fear of not being able to meet the need of a community that needs help. And it's really challenging when there's no playbook for many of the things that we're working on. I mean, for many roles, but I know for folks that are in operations roles, they always say that, an operations person is solving the problems you didn't know existed, and in methods that you didn't even know how to approach and use. And I think that's really one of the things that have really, keeps you up at night. Like, I don't know what's going to come around the corner, but how to actually be present and support for when it does pop up. And I would say that a typical week or a typical day, it really looks like just me saying I don't know a lot, and me saying, and really apologizing a lot. I think apologizing for a lot of stuff that, as Dean Liu mentioned, there's a lot of stuff that's not going well, and having to apologize for broken systems, and in times of strife, the best people are always sometimes the first to go. And you don't need to know much about healthcare design processes and methods and tools. You just need to be able to say, you know what, I don't know what's going on here, but I empathize and I want to be part of the solution and support you. And I think that's really kind of how I see my role on. That's the one consistent, I'd say, every day and every week. I mean, obviously the days themselves look very different and profoundly different based on what's happening with healthcare delivery. You are doing something that relies on thousands of people doing thousands of things 100% correctly every time. And when one place somewhere it doesn't go awry, you will hear about it. And then how do you come back in a way with empathy, but also some fortitude and resolve to say, this is not how we do things. I'm not okay with that, how that happened, because we're not doing what we can to be the best we can be for our community. And I think that's one of the things, again, I really appreciate, Cal and UC Berkeley and the University of California really just saying you can be a leader from where you are, and you can really just embody the change you wish to see in others. So I think that's probably my my overall take on that. But again, I'll have a couple more ideas I think I can share for some of the later questions.
Thank you, Baljeet. And Monica, same question to you.
Sure. Thank you so much. Yeah. And it's interesting. I never actually thought that I would end up in academic medicine at a place like UCSF. And it's just funny because something I really appreciate so much about it is that I can do a really big variety of roles while working with just one position. And so because I have a lot of varied roles, there's no such thing as like a typical week, I'd say. But I'd say in general, I have my clinical work where I see patients in my perinatal HIV clinic about once a week, and then in my family HIV primary care clinic another day of the week. These are both clinics that are in our FQHC at SF General Hospital, where I've taken care of patients since graduating residency about 10 years ago, and so have really close relationships that are incredibly meaningful. So I love my clinical days. And then most weeks I have some teaching engagements with students. I teach a course for the UCSF Prime Urban Underserved program that's dedicated to learning about community engagement and applying anti-oppression and anti-racism frameworks to health and medicine. I'm also involved in several community engagement projects in relation to that, and I try to integrate that into my medical teaching and curriculum development. So I work with many community partners, especially in the Tenderloin neighborhood in San Francisco. So I'm often going there. And then in the week, I usually have a day or two of meetings related to my work with Pacific AIDS Education Training Center, where as clinical director, I'm involved in creating educational materials and curricula and trainings, delivering trainings on HIV-related topics, and also more work on the systems change level, like building the capacity of HIV services in the Pacific region, which includes California, Nevada, Arizona, and Hawaii, as well as the Pacific jurisdictions. And so for that work, actually, I travel quite a bit. So like last month, I went on a capacity building site visit to Guam, the Mariana Islands, and Micronesia. And that was really interesting to get to see the very different ways that HIV care looks in different places, and how you build capacity in different remote island areas where there's very few resources and really unique challenges, and also really unique strengths of community responses. And so that wasn't a typical week. But in a typical week, also, I spend a hefty amount of time mentoring students. So I'm a research advisor and mentor for many joint medical program students who are engaged in scholarly work and research. I also play a big mentorship role in the Prime Urban Underserved program. And as an alum of both of those programs, I feel a lot of reward in getting to continue to be a part of those programs, but as a mentor. And then any given week, I also do a lot of advocacy in my spare time. So I'm a co-founder for the Institute for Healing and Justice in Medicine, which I co-founded with actual students and residents, where we're working to dismantle racism in medical algorithms, clinical algorithms, and also clinical guidelines. And that's been a wonderful place where there's been a lot of great intergenerational activism happening. And in a typical week, I try to do as much dancing as possible too. I really enjoy dance and find that it's like very important to make sure I fit into the week to have the joy that continues to fuel our work. And then what gets me up in the morning? I mean, truly, I think it's really knowing, and I'm sure the other panelists and other folks on this call agree, like is knowing that your work is deeply aligned with your core values. And those values for me are community, love, joy, and collective liberation. And I've done a lot of reflection over the years and have really come to understand that I think what helps keep me motivated and energized and passionate about the work and resisting burnout is really the ability to like seek out work that is aligned with my core values. And I think everyone who goes into public health feels like they can do that. And yeah, and when I've noticed that I'm struggling, usually, or if I'm feeling like unsatisfied or unhappy, it's usually I realize that I'm having to do something that wasn't like really aligned with my core values. So over time, and this is another great thing about I like what I ended up with the position I have is that you can change your role over time. So my role has definitely morphed. I used to have more like a 90% or 100% clinical is how I started off. And then slowly over time, I added more of the public health capacity building roles and more of the mentorship roles. And I think that has been really helpful for me as well. And I recognize that it's an incredible privilege that many people don't have to be able to like really do work every day that is super, super mission aligned. I know, many of my family members and my ancestors did not have that privilege. So I know that I'm very thankful for this. And I know that it is a privilege. Yeah. And for many of us, our passion is social justice and public health and medicine. And like, that's always been, those core values were the driving force behind our career aspirations. And so, yeah, I feel like all the public health colleagues that I meet, well, we have this camaraderie that is usually the very mission aligned, values that we share. And then that doesn't matter whatever the political climate is, or no matter, what's trendy that year, these core values they don't waver. And that's something that I really, really value. And that gets me up every morning, or if I'm feeling demoralized, I try to remember that. And then what keeps me up at night? I should have started with that. I don't want to end on a negative, but I totally agree with Michael and Baljeet. Just like, mostly I'm an optimistic person, but sometimes I do get demoralized a little bit when I'm thinking about just how big the challenges we face are in public health and medicine. And sometimes it feels like the problems are so ingrained into our structures and our systems. And I can sometimes catch myself doom scrolling or dwelling on the state of how, few protections we have for basic human rights and healthcare that's really jeopardizing our well-being. Like we can't adequately treat health conditions when our patients are struggling to afford healthcare in the first place, or we can't help our patients thrive when they lack affordable housing options, or they lack workers' protections, don't feel safe in their own neighborhoods. So it just sometimes it's hard to imagine doing justice to our public health values when we don't have universal health care, while structural racism continues to be a public health emergency, and while, reproductive autonomy is being stripped away. So I try not to get demoralized. Instead, I try to really harness that anger and that into more of a call to action that, as public health advocates, we need to be fighting also for affordable housing and universal workers protections and affordable education, protection for people with disabilities, just all the list goes on, right? And it's all interconnected. And if we can secure some of these basic human rights at baseline, then we can more effectively tackle the challenges of dismantling health and healthcare inequities. I try to focus on what's positive and what is possible. I really do. I'm an optimistic person. I think this is possible. I truly believe that, a more compassionate and equitable world is possible, and that, everybody here on this webinar and just all the change makers that we're hearing from today, just we all play an important role in that. And that ultimately makes me very, very hopeful and optimistic for the future. Thank you.
Thanks, Monica, and kudos on getting us back to a place of optimism. But I understand such big challenges are in all of your day-to-days. I'd like to pivot to a different topic, because we've learned about all of your career paths and the rigorous training that you have each pursued to reach high levels of influence and impact where you are today. At the same time, we also know that experts estimate nearly everyone will experience the imposter phenomenon at some point. And so I'd like to invite Michael first, if you could share about your own experience, perhaps navigating these competitive pathways that can often be the breeding ground for such feelings, and any advice you could offer to our attendees today.
Yeah, I'll give you an example of feeling like an imposter in the room. So I'm the son of two immigrant parents who never went to college. In fact, my mom actually never went to high school or even junior high. See, my mom was only 11 when her father died, so she had to drop out of 5th grade to go work in a sweatshop to help support the family. So when my parents first got married, that we were still pretty poor, the first house that I was born into on the other side of the tracks in Taipei, where a family of 6 was crammed into, no flush toilet, no running water, health insurance. We didn't have health insurance because there weren't such things as health insurance then. And so whenever you guys knew how much the doctor or the medicine was going to cost. And from time to time, my parents had to make that difficult choice, paying for medicine or paying for food. And at one point, my mom actually sold her wedding ring to pay for my medicine. So fast forward 50 years, now I'm sitting in the Obama White House. Now, I actually frequented the White House quite a bit when I was in government because the Obama administration actually cared a lot about children's health. And so as the head of maternal child health in his administration, I attended a lot of meetings at the White House, but usually at the Eisenhower building, like the office building. But this invitation was to the Oval Office. So I was a little excited. So I got there early just to like check things out. And I was like sitting in the waiting room, the Oval Office was like right across from me. And the president wasn't in that day, but I was just pretty excited to be there. And then about few minutes before the meeting started, they collected all our cell phones. So I knew something was up. And so sure enough, I went into the Roosevelt room right across from the Oval Office, and 5 cabinet secretaries show up. Secretary of Agriculture and Education and Commerce and Transportation and Labor. And we were actually gathered there to talk about child poverty in rural America. As you know, 1 in 4 children growing up in rural America today is growing up poor. And it does take this kind of transsectoral approach to solve the problem as big as child poverty. So there were probably about a dozen of us around the table, mostly white men, mostly many of them being governors in the past. And so here I was like sitting in the room and totally feeling like an imposter. And of course, then we started talking about healthcare. And so I remember this moment when Secretary of the Bill turned to me and say, "Well, doctor, what do you think?" And the first thing that came to my mind was, just don't say anything stupid. So like feeling totally like an imposter in that room. And then I remember why I was there. That I was there to be a voice for the voiceless, to be a voice for millions of poor children and families in this country who never get to sit at a table like that, to be able to share both my lived experience, my frontline experience with people who are making decisions that impact the millions of lives. So I guess my advice to our attendees, first of all, just you got to believe in yourself, right? And you got to believe that you belong in the room. You may not be the smartest or the most knowledgeable person in the room, but there's something unique, something special that you bring to the table. And whether it's your ideas, whether it's your perspective, whether it's your lived experiences, that you belong. The second thing I'll say to like overcome the imposter syndrome is just to develop a growth mindset, right? And the best thing, like whenever you find yourself saying, "Yeah, I'm not good about statistics," or "I'm not good at public speaking," just add a "yet" at the end of the sentence, right? And knowing that you can get better. And then I think that the last thing I'll say is just be real clear about your mission and your purpose. And like Monica said, and about your values. I don't know if one exercise that I would advise all of you to do is, when you get a few moments this weekend, just take a piece of paper or type on the computer, write down your mission statement. what you're all about, what your purpose, what your mission is. So for me, my mission statement is just to work really hard every day to give every child both in this country and around the world, no matter where they're from or the family they're born into or the color of their skin, a fair shot at reaching their fullest potential. Right? The kind of fair shot that my mom never got and the kind of fair shot that so many kids in this country around the world still don't get. Right? So if you're clear about your mission and it can be true to your purpose and your values, I think that help overcome a lot of that imposter syndrome.
Thank you, Michael. And Baljeet, I'd like to invite you to address the same question.
Yeah, I mean, talk about imposter syndrome. I mean, for example, between Dean Liu and myself, one of us has been inside the Oval Office. The other guy is me. So I'm going to go ahead and just say that that's kind of, talk about imposter syndrome, just to be around really esteemed colleagues like Dr. Han and Dr. Liu. I would say, that imposter syndrome is real, and for a lot of challenges we have. It's real for me. It's real for me actually, every day. And no, I don't believe anyone says, hey, finally today I don't feel like an imposter. I think, if that's the day, then maybe it might be time to think about the next challenge or something, where how you can continue to contribute. The thing about imposter syndrome, it's oftentimes it comes up when either a challenge or like we don't know what to do. Like, what do we do? It's such a crazy, gnarly, multifaceted problem, and that you're like, oh shoot, like what's the next step? It's not hard to say, well, here's the problem and here's the solution. We just gotta execute. And I think that is not that difficult. You just gotta get out there and then just work through the execution, which obviously is never easy, but you don't have to think through a unique issue. But then you think about, who are you impersonating, right? Like, the person that went before me that went through a pandemic in 1917. Like, okay, like, so, there's no playbook for these things. And so I think imposter syndrome, it helps for these questions, help normalize it a little bit. This is no longer, the idea of traditional leadership, which is, you're, at the front of the pack, always, know everything, can be very definitive and directive. And that's not how it is. And I think this is helpful for us to articulate that we all have imposter syndrome, but also the types of work we're trying to do and sustain. It means that we all have to do this and get there together, not just one person. So you want to have that humility. You want to be able to ask and confer with others and share the vulnerability of, I don't know. Hey, it turns out you're the expert in this multi-step process. You're an expert in these 2 steps. We'd love for you to get us there. And then the next person, you're an expert in these other 2 steps. And I think that's really what we want to do. And I actually think I've gotten to a point where I feel like imposter syndrome is almost it's a little healthy for me. I've gotten to a point where it helps keep me hungry. It helps keep me humble, that this is, there's more for me to learn. There's more for me to do. And there's more for me to just, get out there and intake more around how my colleagues and how the community works. So, and so at that point, I just, similar to Dean Liu's point, at one point, those who belong were new to the room, right? So folks that are in the room at one point, they got there somehow, and they had first day. People just don't come out of nowhere. They come from a specific place, a specific time, and they come out of a specific family or unit. And I think that's where we, when it comes to the imposter syndrome, just think about that, courage is like a kite, overcome it. The contrary winds are what raises things higher, right? And anyone who's never made a mistake has never tried anything new. And I think that's, and I think that's, I want to say that's an Einstein quote, but it's imprinted on myself. So I think one of those elements is really encouraging folks to just step into that. I myself, I couldn't afford clothes growing up. So my parents would get clothes from India. I was born in the United States of America, but it looked like I had just immigrated to the country because the clothes I wore were just cheaper just to get them shipped. And so that was tough. Your people are like, well, you speak English? When'd you come to America? Like, no, I was born here. I just wear these clothes. And so it's just kind of a interesting piece. But I think the one thing I'll end on is that, everyone, especially alumni of the UC network, others that are thinking about their next step, or the soon to be alumni of UC network, just still thinking about what they want to do. Everyone has come through so much. They've worked so hard. They've done things that a lot of us will not understand or cannot begin to appreciate. But getting through all that to get to this point today, to get to where you want to be and to consider the next step in your career, that's incredible. And if you can get that far, I mean, you can continue to move forward. And I think, and I hope with that context, that imposter syndrome is something that can be normalized, but in a way that is helps us and doesn't paralyze us.
Thank you, Baljeet. And we're already hearing from some folks in the audience around this next question. And you acknowledged this earlier, Baljeet, that career paths are not linear. Those bloopers, so to speak, sometimes. And we have folks who are alums who may have studied one discipline as an undergrad and might be looking to shift gears, or who may be making, just the next step in a path that they've been considering for a long time. All that to say, knowing what you know now, what advice would you share with attendees who might be exploring paths, especially around how to identify the right path for them? Any strategies or experiences that you'd recommend?
Oh, is that for me, Caitlin?
Yes. Yeah. Sorry, for you, Baljeet.
Yeah. Okay. Good. Yeah. I would say, the beauty of it is you can, at any point in your career, in your lives, I mean, you are able to pursue your next step. I would say, here in the UC system, that this is a system where we tackle issues head on with the fortitude and empathy that's needed. Where I'd love to have a healthy debate to see what other system can do, what the UC faculty, family, students all can do. So I would say that with that as the context, take a deep breath. Especially at UC, we want you. You have a lot to offer, but you can do it in any order. You can be a physician or any type of clinician and want to go back to school for a public health degree, master's of business administration, a master's of public policy. I think you can also go the other way around. You can be initially at a point where you are doing a master's and say, you know what, I think I've learned enough in the field and I want to go back and be a clinician. I think, no one's going to say, oh, shoot, you only can get one graduate degree in your life. And it turns out you already got the public health degree. You can't, sorry, that's not a thing. And so I think this, it's the beauty of, and I'll put a plug in for my degree of master's in public health, is that you learned that there's no one individual or degree that can make the change that we wish to see, to embody the change you wish to see in others in our community. In order for me to be up there at a board of supervisors meeting, in front of the mayor's office, in front of the federal delegation, I need data. I need support. I need to know what our health and social behavior folks are seeing. I need to know what the biostatisticians are seeing. I need to know what the epidemiology is, right? I need to know how the built environment is going to be affecting what we're doing. So together, you learn how to work together. And I think that's the beauty of any degree you chose. You'll realize where you fit very quickly in the ecosystem. And the last thing I'll impart is that, I think, and Dr. Hahn said earlier, yeah, I do get demoralized sometime. And I do get demoralized in terms of wow, my soul will hurt. The work we do is hard. When you realize some of the health disparities out there, that you're like, wait, men and women that look like my mother or my cousins are actually at a higher rate of dying during pregnancy. So when I was born, my mother could have died. That hurts your heart, but then it also strengthens your resolve for the work we do. And I think it strengthens my resolve because I watch a lot of superhero movies, and I watch a lot of action movies. And that moment when you're feeling at the lowest, then the music plays and the cavalry arrives, and then, the tides turn and the heroes win. You all are the cavalry. That's what I'm so excited about. The beauty of the alumni network in UC and the folks that are still going to join this alumni network in the coming decades are the cavalry for the work we do. And so I think that's the really exciting part. Wherever you plug in, just know that it's not the be all end all. You can do that and you can do more.
Thank you, Baljeet. And I'm going to invite Monica to chime in on this. There have been some related questions around that "is it too late" question, and figuring out, what exact path is and sequencing even is right for, each attendee who might be considering, in some cases, a public health career through an M.P.H, for instance. There's some other masters mentioned in the chat as well. And then, pursuing a medical degree or the opposite. So I want to invite you to weigh in on this these related topics.
Sure. Thank you so much. Yes, thank you so much. Because you can, yeah, there's so many different ways and different order that you could do it. And you may like have a perfect plan and it doesn't even work out that way. And I didn't plan it very, very perfectly or optimally. So I actually did my M.P.H first because I actually wasn't sure I wanted to be a physician or do clinical work yet. So I started with the M.P.H. And yeah, that was because I didn't know what it was like to have a sense. I didn't have a sense of, again, I'm first in my family to go into medicine. I didn't have a sense of what it's like to like actually provide clinical care all day until I really got to work alongside clinicians when I was working at Asian Health Services at their teen clinic. Then I got a sense, but that was during my M.P.H. So I eventually learned that I really loved clinical care, and that was what made me realize, oh, I do want to pursue an MD after I get my M.P.H. And so, you know, what's exciting about public health is that we all have a part to play in this systems change, no matter what our role is, as Baljeet was saying. And you know, if we're lucky, we work at multiple levels, sometimes in series or sometimes at different times in our career, and sometimes simultaneously. So I'm kind of all over the place. So I'm a little bit doing different roles at the same time, but I would say that's not necessarily the norm. You know, you could do research, you could do advocacy, you could do policy work, you could do clinical work, medical education, teaching, and like there's so many different ways that we all contribute to this work. And I'm kind of like a stereotypical family doctor where like you can't pick your favorite thing and you just want to do all of it. So that's a little bit why I have kind of a really varied position, the way that I have it. But I'd say that most people don't necessarily have it that way, or they may not do it at the same time. But yeah, for me, the especially important question for M.P.H versus MD versus both, when that was posed to me early in my journey, I really learned along the way that the way that I was going to advance health equity in my career was not going to be by doing research in a lab. That definitely was not my jam. I'm glad that I had the experience of doing that, but I know that it didn't optimize like my particular strengths. But what I did find out from early experiences as a sex educator and counselor was that I really, really loved the one-on-one deep listening and getting to know someone's story and having like a dialogue with them and doing motivational interviewing and all that stuff. That relationship building was totally my jam. And I'm an extrovert. I get energy from being around people and, you know, talking to people. And so for me, I think like I had to understand that optimizing my gifts and having the most rewarding career for like me personally, uniquely, it would be that I would want to have direct patient care involved in it. And so that's kind of what led me to the specialty I did, which to family medicine, where I have meaningful longitudinal connections with patients. And you know, that's how I decided, like, okay, I think I am somebody who really does want to have a clinical background as well as the M.P.H background. And so, yeah, that was absolutely the right choice for me. As I said, I've been taking care of families affected by HIV for over a decade now, if you count the patients and families I met in residency at SF General, and who are still on my primary care panel today. And part of the, I know we're running out of time. I had to say the one of the most special, rewarding interactions that I have now as a perinatal HIV specialist is really getting to be a part of like having people kind of like realize their dreams of building families and having thriving, healthy children, because, you know, we now have the medical advancements in treatment where we can guarantee that people can have healthy pregnancies and their babies will be born free of HIV if the pregnant parent is consistently on treatment. And that wasn't, you know, we weren't always there. And it's an exciting time to be providing that direct clinical care. But that's also like, you know, that's something that I really, really appreciate the systems change work for me, because sometimes, you know, in a 15-minute or even hour-long visit, you can't address all the things that are happening in somebody's life and affecting their public health, and especially at a population level. So there's just so many different levels where you could be working, and it's just about finding like what's your jam and like what role or pathway is going to best do justice to the gifts and the talents that you have. Yeah, thank you.
Thank you, Monica. And briefly, I want to invite Michael to chime in on this topic. Is there anything you'd like to add, Michael? There are a number of folks wondering how do I do both? How do I balance?
Well, first of all, I just want to add that I am just so in love with Monica and Baljeet right now. I'm just so proud to be kind of leading a school that's producing such amazing change makers and arc benders. Arc benders have had bending the arc the moral universe, toward health equity, toward social justice. So you already heard, okay, you can do both. You can either do it like Monica did, can do your M.P.H. First, can do it kind of simultaneously, as I did. But I also kind of want to point to those in the audience who are already in clinical practice, doctors and nurses and PAs and other health professionals, that you can come back to school to get your M.P.H. And we actually offer an online program. Actually, it's been rated the best online M.P.H. program in country. So you can keep working and stay in your community and stay with your patients and so forth, kind of while getting your M.P.H. degree. So you can look up our online public health M.P.H. program. I also want to just a quick plug for our those of you who are living in rural communities, that we're actually offering full rights for you to get an online M.P.H. program that's made possible by a gift, a $10 million gift from one of our alums. But the only condition is that you have to kind of live in and work in rural areas, because the efforts really try to help health professional leaders to get an M.P.H. degree so that they can work on improving, innovating, transforming rural healthcare in Black.
Thank you, Michael. And with just about 5 minutes remaining, I want to acknowledge an important theme in some of the questions coming up from our attendees today around balance and burnout. You all are doing so much, and you are involved in such transformative work, but also carrying a lot in your respective careers. And so I wonder, one, is there anything you'd like to share with attendees on this topic? Some even wonder, do you sleep? And I have to wonder that myself too, hearing everything you're doing. Anything on the topic of balance, and also an invitation to share any final piece of advice. And so, Michael, let's bounce back to you, and then we'll go from there with any last words for our attendees today.
Oh my gosh, can we actually start with like Monica and Baljeet? I don't think I'm a really good example of the balance, because I love my job so much. I'm so passionate about it. And I think I probably ranked in the 99th percentile in terms of just work satisfaction. I find so much meaning and purpose in the work that I do. And so yeah, I do work pretty long hours, but and some days are incredibly frustrating and exasperating, but some days are incredibly inspiring. And so I really kind of run on that.
Well, Michael, I appreciate your authenticity in answering. I think that is what our attendees are looking for. And Monica, maybe I'll go to you next. You shared also about your love of dancing already, and want to recognize that.
Sure. Thank you. I love this question because, yeah, we live in such a deficit model sometimes when it comes to, we're trying to problem solve, right? When it comes to medicine and public health. And sometimes it constrains us to only thinking of how do we solve these problems? How do we put out these fires? And we don't have a chance to have just open imagination for what are the things that are really great, and what are the things that we do to balance our lives, and what is outside of work also. And we all have our lives. We have, I'm a mom, I'm a caretaker for my elderly parents, and my partner is not in medicine, and we likes to have weekends, and they are really my anchor as well. When it comes to if I start to have a spiral of just complaining about medical stuff, and my kids are really little. They're 4 years old and 7 years old, and we want to have time to spend with them. And so yeah, I really do try to have time to do dancing and do other things that keep us active, and remembering what is all good in the world that's worth fighting for, right? Because sometimes we're always about what are we against, and it's hard to remember what are we fighting for, and what is worth all the efforts that we're putting forth. Yeah. And yeah, I think if we're doing our final messages, yeah, I just think, again, just saying that there is definitely a place for everyone's unique gifts in the fight for advancing public health and health justice, and that you are right where you need to be. And especially if you're really seeing what your core values are and what aligns with them, it will lead you where you need to go. And it's somebody had asked, is it ever too late to go to medical school or go to any school, especially if you're only 4 years out of undergrad? It's never too late to do anything. If that's what it is that's calling you, I feel like it's never too late. I mean, people could argue I wasted more than 4 years of time doing like multiple masters and doing, working. And at the end of my career, I'm not going to regret that at all. Like, I won't be like, oh, I wish I had like gone to med school 4 years earlier. I don't think that that's going to be the end all be all. And just I think we just remembering what go from a strengths-based model, what is the joy that we have in our life, what's the radical positivity, and from there we create the change that becomes the world that we want to live in. So yeah, thank you.
Thank you, Monica. And I know we're at time. I'm going to invite Baljeet to share a final note. And I just in advance want to thank all of our panelists for their time, generosity, and commitment to the University of California. And all of your insights and advice have just made me especially proud to be part of the UC community. And we look forward to following up with all of the attendees today, including with some resources that have been mentioned or that could be helpful for other questions we weren't able to get to today. But Baljeet, take it away.
Yeah, final 30 seconds. I would say just, appreciation for everyone for joining today. I would say, there are things that you like to do. There are the things that you don't like to do as much. And so the things that fill your cup, whatever it is that you like to do, just do more of that. I like to watch TV, so I figured out a way to put it on the treadmill while I walk around like a crisp 4 miles an hour, 5 miles an hour. And, the realization is also outside of that, the last parting piece of advice would be, you don't have to be someone else. There's already a version of that person. You be you. That's what I think is the most important piece. It's not a race. A 30-minute mile is still a mile. And so I think just keeping that in mind. And again, looking forward to seeing a lot of you, all of you, in future programs and future conversations. So again, thanks again.